Can you hear me?
I can.
Repeat yourself again. So why should they have responsibilities?
Because they are offering services directly to the client. That is, and they are also responsible for their own health and safety as well. Each party has a role to play in the health and safety.
Okay, that's very good. That's very good. So we are recapping what we had the last time. So it's quite important that we don't leave healthcare practitioners, support workers, care assistants, and all the allied healthcare professionals. It is important that they do not leave health and safety management to the hands of only the employers. They also have a duty of care towards themselves and the patients that they work for. So health and safety is everybody's business. It's not only the business of the employers. So in that, you don't leave and say that you don't care because it's your employer's responsibilities. The employers are meant to create an enabling environment at the place of work. However, it is most the healthcare professionals we should extend those health and safety measures and methodologies and making sure that those practices are adhered. And we had mentioned that it is important that we come to terms with two things when it comes to health and safety. What we say risk assessment. The last lectures we spoke about what is risk and what is hazard. Let me say risk and hazard. Hazard is a likelihood of something to occur, So we mentioned of all these things, but it's important that we look at what then is risk assessment. In risk assessment, we have to identify what hazards currently exist or may appear in the workplace. So in risk assessment, we are identifying unforeseen hazards or accidents that may occur, and then trying to identify them and then put measures in there to sort of mitigate or prevent those hazards or accidents from occurring in the workplace. Okay, right. So in risk assessments, four things that we tend to do. One is to create a care plan, which is when we say a care plan consists of all the informations about a patient that you are taking care of, and then what they dislike and like, and putting all other information that a carer should know. Normally, the social workers would have, before they refer a patient to a service provider, they would have done what we call a massive, thorough staff information about the care plan, which also sometimes involves the risk assessment, and then they pass it on. Then these care providers would also have to do their own assessment. So that's what we call a care plan. A care plan consists of all the information about the carer, what they like, what they don't like, and most of the information is from their history of health conditions and all that, so that it better informs you, the carer, to know much about the patient when you visit. And one of the key things you do is look at the care plan. And then we have the risk assessment, which I said it's a care plan would always involve the risk assessment as well. And so the care plan may have many things that you will need to do, especially in moving and handling, how to move the patient. The patient is mobile, not mobile. The patient can walk or cannot walk, or the patient can speak or cannot speak. You understand? And so all these are things that uh, includes in the risk assessments, and then you have the compliances and quality of services, and then funding for the care and funding for compliances and quality of services. Of course, they should comply with a lot of um, patient care. There are a lot of compliances that what do you call it? The care management organization should comply with, and the quality of care. It could be CQC compliances, it could be the health and safety management compliances. It could be food nutrient compliances and all that. Those are things that need to be adhered and complied with. Then lastly, you can look at funding for the care. Funding for the care. Funding for the care is the funding that the patients would need so that a carer can come and take care of them, or a service provider. So without funding, state funding, it becomes very difficult for a service provider to provide services for them. So the social workers normally apply for funding, so government support for this. In the UK, government support, what we call the Social Care Act. The government support, or normally from the council, that will enable a service user to be well catered for by a service provider. Okay. How to do risk assessment for social care. So let's watch this video. How to do a risk assessment in health and social care. Play the video. And then take it. Risk assessment. So you went off again. You went off again.
I can't hear anything in the video playing.
Letter, can you say it?
Yes, I can.
Okay. So let me just 1 minute.
I can't hear anything.
You can hear.
Yes.
Oh, that's strange. That's 1 minute. That's 1 minute.
Supervisors are responsible for ensuring.
Can you hear?
Yes, I can.
Okay. But the video, can you hear the video?
No, I'm not hearing the video.
We can't hear.
From lifting or repositioning residents, falls from slips and trips,
No.
This lady took to here from the hospital. Since the door's locked.
Yeah, so we're expecting this is open.
Yeah. Right? I to work with me of try to regulate this financial class in that particular question. The work I work in this because the type working this financial should look at some of this. The process coming that yourself, they have already touched on the transfers and then the kind it was hard to make the usual almost not 20% coming. You never have a thing before. You should look at someone to yeah, most likely, number for my is 7% of the sales like it's a separate assets. Just say, when we simply should issue because and so to make for money. It is normal. It's normal. It's a lesson you saw. The money you remember. Someone again, you go so cheap and so many. So when you got my friend yourself, so I'm out. So definitely, you should go to the coin, you know. I don't work in the section on the domain. Yeah, really, something like that. I can see. I'm present with some. This would be for anybody. When you know, and then was what as if this would be a new contact. The about music graduation and should give us a serious should claim of the district. As it's coming something after the graduate courses, but there are some engineers on which we contact with science areas, not like maybe you are said to say, my family as a sign as an engineer. Which is some of them as not back in the situation of the problem. Some of us which probably say the same thing. We have a chair different. Probably chair about that. No, listen, yeah, listen, listen. Like as I said, we have something so we should do this. Maybe to market we should do. It's like the music kind of chair. Yeah, I'm not learning that. The catch on the side. I catch you on the side. Takana and the no team was the boss. Say, so then we are silent. To my point, you know, not having the same issue. But this week, this week is make up for the implemented have the qualification again. Means environment complement yes, it may have input down for the down atmosphere. It may have for the family. It is about think I need to critique someone that was your desire. Think I need to critique accounts that's a bit which you got atmosphere. Person on members and make a commission on to see a time. But normally, if I'm not we quite I think it's not the only video. Who could you be able yeah, what am I saying? We go to the on the day. Seriously, by your and no son up in line. But not become a very difference. Monkey back on my movie time, you should now seriously so the enemy. What am I saying? One time, yeah. But you would on. But you would on. But you would. Vanessa.
Yes, what is happening?
Why? Can you not see the video?
It's an ad that is
Hello, Vanessa. Hello.
Yes, I can hear you.
Vanessa, can you hear me?
Yes, I can hear you.
But if you send a message,
I beg your pardon.
can you? Okay, just hold on. Can you see the screen now?
Yes, I can.
But you're the same person say you cannot hear the this thing. You cannot hear the sound. Hello.
Yes, I can hear you. Let's continue. I'll open those videos later.
Yeah. Yes. I'm just yeah. Hello. We could have said a long time ago. What's the problem? Vanessa is already on.
On, right?
Yeah,
Because,
yeah.
she just texted, hello, what's happening? So I thought that
No,
if she's
Vanessa, hold on. Vanessa, can you speak? Hello.
Yes, I can hear you.
No, but the office said you say you're not online. Hello.
Just I was asking what was happening
That's
because the video was playing and you were talking to someone else.
Hello. No, it says he claimed that he could not. I was speaking to someone because he said he cannot find the video on YouTube. He could not hear the sound of the person speaking. Okay, so I need to find a way of getting yes, and I don't know why because the video playing from my side was playing and the sound is okay, but he could not hear. He could see the video, the pictures, but he could not hear the sound. I was playing some lecture videos, so I don't know how that can be sorted. So I was trying to get that unsorted. All right.
Can you please continue?
Vanessa, no, but if anything, you need to if we let you in and you claim that you could not hear the video, so you think I won't call the office and find out how they can sort that. So why are you saying that I was talking to someone? Did you not complain that you could not hear the video, the sound of the video? Did you not say that?
That's what I said.
Yeah, so if I'm solving that, I wouldn't I talk to my office to get that one sorted for you? So why are you complaining that I was talking to someone at the back? It's the office you have called me again. So I don't understand. I don't understand. If anything, you send a message. Okay?
Yes, I've been sending to you messages. And I went to our group, the discussion group, and I asked them what is happening. That is all. You can check in the group and see the message I sent.
Anyway. So we see the recordings on. So we have to look into how we can analyze risk assessments for individuals and organizational decision making about policies and procedures. So I've just said that risk assessment is normally a written record that shows the management has identified potential hazards. Now we have to look into first the legal legislation, which we've mentioned that the Management of Health and Safety at Work Regulation 1999. And anytime I'm asking if you can hear me, I need you to respond because I mean sometimes your internet goes off and all that, and I don't know. So you need to be responding so I know. Okay. Okay. So the legal requirement to make this assessment due to the Management of Health and Safety at Work Regulation 1999. Okay. Now, the information from the risk assessment can be used for individual care planning, as I clearly indicated, care planning or organizational decision making regarding health and safety policies and procedures. So, what it means that risk assessment can function in two ways, either for care planning for the patients or the general safety policies of the organizations. Okay, and we ought to have regular review and update the risk assessment portfolio. Why? Because there may be changes every now and then. One pertaining to um, the patient's mobility or patient's health and safety environment, and therefore, if you don't do reviews every now and then, you cannot tell at the present stage how the patient is feeling. For instance, a patient may be able to walk at the time, maybe last year, a year ago, the patient may be able to walk very well. Maybe the new year, the patient may not be able to walk. So if you have not done a new risk assessment, you cannot tell the state of the patient, even with the environment where the patient lives or even the hospital. There ought to be a, a risk assessment, the mobility, how well the patient can walk. Is the toilet facility closer to the patient or not? So a patient who cannot walk that long, you wouldn't want to place a toilet facility very far from the patient. You need to have a toilet facility in the hospital, in the plate, you understand, rather than. So these are all what we call risk assessment. So there should regular update of the risk assessment and review the patient needs and follow up the risk. Okay. All right. So we look at a quite example where we could use fire as a hazard in the workplace. In the risk assessment, it should have been written there could be potential cause of fire, which is true. One of the key functions of risk assessment is to identify the hazard. So one of the hazards that we could look into is fire. Okay, is fire. Now, because there could be potential fire, there should be risk assessment, and those could be cigarettes, damage or electrical equipment, excess dust in the tumble dryer filter, and all that. These are very important areas that we can look into. A clear example is what I've just mentioned. So, to maintain health and safety, the company should have policies, procedures for place of smoking, you know, having a non-smoking policy for the building, or they may have to inform the workers or employees to go out, step out the place and have a place that patient and they can smoke. So these are things that you have to put in place. Having an end of shift checklist for the laundry worker to ensure that the dust is removed from the tumble dryer, very important, because the tumble dryers would always ignite fire when there's dust, and when the dust are piling up, it will ignite fire. So it is important that after every wash, the dusts are taken off before being reused again. Okay, and also informing new employees to escalate any faculty electrical equipment, e.g., the fire door retainer is not working and all that. And then lastly, if the fire occurs, the duty of care to move patients in immediate manner. This normally will be trained patients and service users. We have a duty of care towards them. So as a carer or a management person, normally you will be given an orientation when you start your work as to how you go about when there's a fire emergency in the building, where to step, where to evacuate patients and yourself through, where you have to gather, when there's fire safety. In fact, there will be regular drills that would when there's a fire sound for 3 continuous times, it means that there's a serious matter. When you hear the fire sounding continuous for 3 solid times, it tells you the fire safety, and therefore you quickly have to find out what you do and evacuate yourself. Okay, so these are things that you will need to know as a carer. Okay, so risk assessment process has 3 distinctive and sequential stages. The social worker or social care practitioner should go through each of them with the adult and or carer. What's then risk? Risk is the probability that an event occur with beneficial or harmful outcomes for a particular person or others with whom they come into the contact. The risk is a product of likelihood that an event would happen and the impact that the thing happening would have if it does. Okay, so risk is the probability that an event will occur, beneficial or harmful outcome for a particular person. So we've explained this before, and how to deal with this risk properly is a crucial to distinguish between the following stages in the process. So it was said that Clark and R 2011 suggests a 4-stage process to discuss risks with people with dementia and their families. Through the studies are perfectly adaptable groups. People were into contact with social care. So we have to understand the person's circumstances. We have to identify the risks. We have to assess the impact of the likelihood of the risk to occur, and then we have to manage the risk, which is very important. So identify the risk in the life context of the individual and their circumstances. I've explained that before. We have to identify, therefore, impact on quality of life and individual well-being. Very important. Then you have to identify the risk perspective for all the people involved. Okay. Then we have to identify the weighting of the risk. Okay, is it heavy? Is it a huge impact? Would it be light when it happens? To establish high or low risk concerns, the impact on emotion, social, and psychological well-being. So the weighting of the risks, we have to look, would you place them in a high risk or low risk? Those will inform you as a carer or social worker to know how to put in and the strategies in place to offset this when they happen. And you have to identify the current and past strategies for managing the risk. So what were the previous risks and what is the current one that you have to put in place? Okay. Are you there?
Yes, I am.
Any question at all?
No.
Okay. So let's proceed on to the care plan. I've already explained a bit of the care plan in our earlier discussion, and I've clearly stated that the care plan is the general implementation of how to support the patient's needs. It consists of everything about the patient, inclusive the risk assessment that we are referring to. Okay. I'm sure you know about care plan, Vanessa.
Yes, I do.
Good. So the care plan involves any other thing all about the patient and also ensuring that it includes its risk assessment. And so in fact, in the care plan, that's where you can get the nurse of kin, the food that the patient likes and they don't like, his mobility issues, almost everything about the patients. Okay. So Vanessa, in your personal experience, what do you know about the care plan then?
First of all, I think a care plan firstly states, for example, the fees, the funding, then the feeding, how you're going to be, what you're going to be feeding on, how and when. And then it also includes some personal details of the patient.
So Vanessa, we can say that the care plan contains everything about the patient, isn't it?
Yeah.
Good. Right. So, but did you know that the risk assessment also includes the care plan?
The risk assessment is included in the care plan.
Yes. You know about that, do you?
I just got to know today.
You didn't know, right?
No.
Okay, so the risk assessment is always included in the care plan. Although you may have so a proper well-documented care plan, a portfolio should also have the risk assessment. Okay, because if we are saying that the care plan involves everything about the patient, it means that it must also include the risk assessment of the patient. You understand me?
Yes.
Okay, yeah. So the risk assessment is that whatever the social workers or the care provider have identified at risk of the patient, it is important they include in a care plan because the carers would have to read that to know how to cater for the patient. You understand me?
Yes.
Exactly. So where we can say, like I've explained, the risk assessment of the patient, probably the patient cannot walk that long, or he could not because of his mobility, because he uses a wheelchair. And so the risk assessment would therefore enable that this patient probably in the past he used to walk to use an outside toilet of the room, but because of the risk assessment, they have to put a new toilet inside his room. You understand? Rather than going outside.
Yeah.
This is what we call risk assessment, exactly. And so you, as a carer, when you're reading the care plan, there was a risk assessment part that you're going to see. Maybe say that patient require two, three, three patients or three staffs or two carers to lift him up. Do you normally see those things? You understand?
Yes.
Exactly. That's what we call risk assessment. It's because of the risk assessment that is why you need two carers to lift him up because his mobility is gone very bad. Okay, and therefore previously maybe he walks by himself, but the new risk assessment will reveal that he cannot. So you need the two carers to lift him up onto a wheelchair before they can move him to go and shower him, or sometimes it may say that the patient cannot move. So you have to do what we call bed bath. You understand? The patient
Yeah.
may be bed bound, and the word bed bound means that he cannot walk or stand up at all, isn't it? So
Yeah.
you would have to give him all the bathing or showering on the bed. These are what we call risk assessment. Okay. Another risk assessment may be that once a while the patient would have to smoke, but maybe the smoking, he might be allowed to smoke, but not within the building. You understand? You'd have to escort the patient outside the building to smoke. So these are what we call risk assessment. Okay. So an example, a risk assessment informs the procedure we need to follow. The main purpose of Children Act 1989 is to safeguard children and promote their well-being, their welfare. There should be a policy to help this legislation. Without risk assessment, if we fail to keep the children safe, there will be a negative consequences because there is no proof that the management have visited the policy, stuck to the protocol and legal requirements. So what is saying that if we don't do risk assessment, then we don't have any evidence that we have really visited the place or the property. You understand me?
Yes, I
Okay.
do.
So by risk assessment, you can then then show evidence because but if you have not done that, you can't show evidence. And then if there's an issue, what evidence would you show that indeed you did some risk assessment and you had all the information on the patient and you pass it on? Risk assessment is a right record to ensure we are providing the best practices to our patients. If indeed not, we might be accountable. Very, very important. We might be accountable. So let's look at Vanessa. Let's look at a raw case, an actual case that happened. Okay, K was a home assistant on the first visit to a new client. Mr. W, she had been warned that his house was in a poor condition and that he had he had a large dog. She knew that he had a history of psychiatric illness and had in the past been admitted to the hospital compulsory under Mental Act 1983. When Kay arrived on the first morning, outside of the house was a poor state garden was overgrown. It was full of rubbish and old furniture. The front door was half open and she saw that half the floorboards in the hallway appeared to be missing. There were simply joists and a drop into the cellar below. Mr. W's dog was at top of the hallway growling and barking. Mr. W was at the top of the stairs shouting, "You won't get me out of here. I will kill you first." Okay? All right. In that scenario, it is case key responsibility to keep Mr. W as safe as possible. It is also his legal responsibilities. In order to help and safety in a workplace, this domiciliary care are required to find out the hazards and possible risk factors in Mr. W's home. Is that true or not?
True.
Good. Since Mr. W owned a dog, K should weigh up all the possibilities of infection through this pet and what risks involved here for Mr. W. Then K should analyze all hazardous substances on Mr. W's home and the address in the domiciliary home. Very, very important. Do we agree with that, Vanessa?
Yes, I agree.
Please, why, Vanessa?
So as to, first of all, to keep Mr. W's life out of danger from the dog in case of any illnesses or diseases from the dog, then analyze all the hazardous substances of Mr. W's home and their threats in a domiciliary home. Here, understand that K should pick out, look for those different hazards that maybe could cause a fire outbreak in Mr. W's home or any sort of injury.
That's very good. But one thing you didn't mention was the health and safety of the dog, how safe the dog is. If there's no sicknesses with the dog and all that, you didn't mention that.
Yeah, mainly looking at the health of Mr. W. What
Okay,
does the dog could cause to him?
okay, yes, yes. So if you realize, because patients have their rights and what they choose, we cannot, in health and in risk assessment, we cannot say because of risk assessment, he cannot have a dog. You understand me?
Yeah,
Because they have their personal choice. However, we have to look at the hazards that this dog can possess. So one of the main criteria in the UK or abroad is that the dog should be well vaccinated and without devoid of any repeats or any sickness. You understand? Okay. So that when there's any such and well trained against anything that will lead to biting and all that. So very, very important. In fact, if the dog can be very dangerous, in the risk assessment, it could be advised that if Mr. Risk will not have a dog, because if that dog can be very dangerous, it cannot come in contact with patients with workers that will come there. So there must be a cage where the dogs have to be kept. You understand me? This can all
yeah,
include in the risk assessment. It can be in risk assessment, you identify all these possible things and making sure you are putting measures that will not cause any hazard that will happen. So let's proceed on. Well done. So health and safety policies sometimes can create dilemma in relation to company decision making. Dilemma refers to difficult, undesirable trends. There are different types of dilemma in health and safety as a resource implication, which to serve on others, different priorities between stakeholders and human right of patient and safety. For example, patients who lose their mental capacity will be restricted to leave the building without supervision due to the deprivation of liberty safeguards. This legislation overrides the Human Rights Act 1998. If they did try to get on their own before on the risk assessment, it would have said that they are high risk, hence there will be a policy put in place that linked to the procedure. Very good. Okay, so that's what it means. If a patient lacked mental capacity, it would have been restricted to leave the building without supervision due to deprivation of liberty. That's true. This legislation overrides the human rights. If they did try to get out on their own before, on risk assessment, we would have said that they have high risk, hence there will be a policy put in place that linked the procedure. So there should be always a policy in place to augment or to deal with the hazards that have been identified. If patients go off their own, we could have rang the police and put a record on system regarding what it means that there are some patients who, for a better of more description, in the risk assessment, they may be able to do things on their own. You know, some patients, they can be allowed to go out on their own and come back on their own. But in the situation where they are on their own and they lost, we have to inform the police. You understand me? Because the risk assessment says that they can do things on their own. Do you understand me?
Yes.
Yes, they can go out and come in on their own. But we have a duty. Once they go out and it's taking long and whatever, we have to inform the police. That's what it means. They say when they lost clothing here, they looked at hand this information to the police. Okay, we have to handle this information to the police. Now, according to Care Act 2014, we have a legal duty to safeguard our patients, such as making sure they are safe in the building. If anything did happen, we are accountable to it because we checked all the boxes to follow the protocol. Companies agreed ways of working, very, very important. We have a legal duty to safeguard our patients, such as making sure they are safe in the building. If anything happens, we are accountable. Okay. Now, health and social care services workers often face dilemma while implementing systems and policies. Okay, while implementing systems and policies. So let's take a scenario, Vanessa. Let's take a scenario. Now, this scenario, a social worker is asked by a service user's interest. A social worker is asked by a service user's nearest one about the progress of his diagnosis. Her service worker may face both the problem of sharing the information and not sharing it. In order to comply with Data Protection Act, he cannot share the information without service user's consent. On the other hand, this might be helpful for the diagnosis process of the service user. Another example would be a scenario where a service user in domiciliary home is trying to get out of his home in order to read a newspaper. Here, a social worker would be in a dilemma whether to let go to read a newspaper, despite the fact that he is not aware about traffic safety. But that's about your take.
On the second scenario.
But you can take the first and so should I go over the first again?
A social worker is asked the service user's nearest one about on the progress of his diagnosis. Here, for the first scenario, I think the social worker, first of all, would have to seek the consent of the service user before, according to the Data Protection Act, before giving out any information. I think that's the right procedure. So I don't see why there would be a dilemma here in the first scenario. Maybe if you could explain.
Okay, that's a good answer, Vanessa. No matter the situation, so you don't see any problem here, right?
Yeah.
You don't see any problem here. Okay. All right. What about the second one?
The second one. The second one is quite confusing.
Is it?
Yeah.
Okay. So let me read again. Another example would be a scenario where a service user in a domiciliary home and is trying to get out of his home in order to read newspaper. Here, a social worker will be in a dilemma whether to let him go to read a newspaper, despite the fact that he's not aware about the traffic safety. The possible questions, Vanessa, we will need to ask us. I don't think it should be a dilemma. Why? Because is he allowed to go out on his own by the risk assessment? You understand me?
Yeah.
Those are factors you have to consider. Is he, because the risk assessment will provide that a patient can go out on his own without no supervision. I don't know if you are getting me.
Yeah, it may not.
Correct. So for me, these are possible underlying factors that we have to answer. If it is allowed by risk assessment, it will state that the patient can move on his own. You understand? Can go
Yeah.
out and come. He has the mental capacity to do that. It will be in the risk assessment. It will be in the care plan. 2, we have to consider, is he blind or not? You understand me?
Yes.
Exactly. Obviously, we cannot allow a patient who is blind. Can we?
No.
Exactly. So all this may be, so it should be informed us as to where. So is the patient blind or not? Does he have dementia? You understand me? Is he a confused patient? So this will advise all to know that is it a patient that should be allowed, can be, or would have what it takes to go out on his own to go and manage with that. If that is not answered, it means that the patient will have to go with someone. Okay.
Yeah.
Now, lastly, there are some patients that require 2 people to be with them because they are very strong because of their confused state. Okay. Because of how confused they are. So even a one person cannot go with them. You understand me?
Yeah.
It may need 2 carers to go with this because such a patient, when you take him out or take her out and he gets agitated, one person cannot deal with it. Sometimes you have to even call the police. Okay. Okay.
Yeah.
So the social worker will be in a dilemma whether to let him go to read the newspaper, despite the fact that he's not aware about the traffic safety. So these are the questions.
Yeah. I feel like if the social worker has gone through the risk assessment
Thank you. Thank you.
for that particular patient, there wouldn't be any dilemma because they would be seeing.
Amazing. Perfect. Exactly what I want to say. So those are the things. So you will definitely know if the patient is blind, it will tell you. The patient is allowed to go on his own, it will tell you, isn't it?
Yes.
If the patient is confused, in fact, even when at times the risk assessment said the patient can go on his own, when you know that the patient is very confused, you understand, it's dementia.
I
So
think
it
that's
could
where
lead to
the
something.
dilemma comes.
Come again.
If the risk assessment allows the patient to go out despite giving some facts, then I think that's where the dilemma arises. You as a social worker may very well know the problem of this patient
Thank you.
against what is written down in the risk assessment. I think that's where the dilemma
Dilemma
comes.
starts in exactly. Because the risk assessment may say that the patient can go on his own. However, on the ground, you are realizing how confused the patient is becoming. You understand? And you feel that by going out, he may have issue with the traffic safety and all that. So these are things. Now, I would always advise my learners and say that in such situation, when you are in a dilemma, you can get closer to your line manager. You understand me?
Yes.
And seek a second opinion so that you don't do anything, or if there's any senior support worker there or something, and say, look, this is the situation. Patient is getting more confused, even though he can go out on his own, but we realize that he's getting more confused and his ailment is coming, and therefore it's a concern. You understand me? Yeah. And the line manager will advise you so that you cover yourself, isn't it? Or you
Yes.
cover your back. Okay, so these are compliances. So all we're talking about is about compliances, trying to make sure that we are complying with the law, not doing anything to violate the law, isn't it?
Yes.
Okay, good. Yes. So the first one, you spoke about consent. That is very important that you seek consent so you don't violate the data protection of the patient. The second one, we are saying that you have to go with the care plan and making sure that what the care plan says. However, where you feel that the care plan says something and the other side of it, that the patient situation is changing, you need to seek clearer and go beyond and go to see your lab manager to seek the lab manager's opinion, or your care manager, or your care manager, or your registered manager in the building. Okay. So non-compliance with existing laws and regulations have serious impact on health and social care safety. Some examples will be violation of patients' privacy or confidentiality, failure to maintain a required food safety, failure to assess the risk, and so on. The impacts of the failure to meet this legislation affect both the employers and the employees. Okay, and the employees of health and social care are certain. It could be financial fine, cancellation of license, or even imprisonment. According to the Section 37 of Health and Safety Act 1974, if any one of the healthcare settings found to neglect this duty voluntarily when he or she can be prosecuted, even the directors of this workplace can go through this Section 37 procedure. Okay. According to the Section 37 of Health and Safety Act 1970, if anyone of health and social set found to neglect his duty voluntarily, then he or she can prosecute. It's a very serious matter. Okay. Generally, a normal non-compliance is dealt with issuing warning. For more serious cases, improvement notices have been shown by the regulatory bodies. This notice indicates the violation of law, and a certain period of time will be given to the organization to improve the overall health and safety situation. We are accountable to safeguard our patients due to the Care Act 2014. Very important. If we found out there is a non-compliance performances in our workplace, we should fight with the policies, with the procedures to cover ourselves. By document and escalate it, we implement the health and safety policy that will create a safe environment. These are important things that. The last thing, let me go. If we identify new hazards in the building, we are responsible to inform our manager due to the Health and Safety at Work. Very important. 1974. If you identify new hazards in the building, where hazards may be that the patient is situation is getting worse, and you are the only person who, but the manager might not know because you are working with the patient directly every day, and then you can tell that the patient situation is getting worse. You need to inform them. You understand me?
Yes.
You need to inform. You have to be in your documentation, so that they can read and have a new risk assessment of the patient. The patient is not eating. You used to eat before, now he's not eating anymore. He's not drinking water anymore. He's getting tired every now and then. There's a lot of insinuations going on. He's shouting, he's saying, I'm seeing something. All these things. You are the one. These are hazards these are new things that you identify. You have to record it and inform your management so that risk assessment can be done to manage the risk. The protocol can be used to reduce the risk by telling everyone what is new company policies and procedures to maintain health and safety in the building. Okay? So,
Yes.
good. So the references we can get there is all below here, available from Health and Safety Social Care Online, SC, Department of Liberty of Safeguards, WWSCI. These are all references you can get from your models. Okay, I will send you later on the YouTube as well. So additionally, what we spoke about is what has been captured there. Any queries you can email us, and we expect that your submission is done for this lecture. Your submission after 2 weeks of completion of the units and delivery. So, do you have any question at all?
No.
So let's go and check the assignment submission.
Check the assignment submission.
Say it again.
You said let's go and check the assignment submission.
Yes.
Like, right?
I'm going to share it 1 minute.
I have a question.
Go ahead.
Don't you provide, when do you provide the sample assignments?
Sample assignment.
Yeah, like, for example, we've been provided is one so far when we finished people in organization. But for the previous two, we haven't, and they told us it is provided on the Moodle. So I'm requesting if, in case you have it, you avail it. That's assignment sample.
Okay.
Assignment example provided by ATHE.
Okay, so if I get you right, Vanessa, you say assignment sample, you say. Is it sample?
Yeah, a sample of when do you provide it?
from the perspective of the student or the lecturer?
I beg your pardon?
Is it from the perspective of the student or the lecturer?
From the lecturer. Because I got one for people in organization. It was provided by the lecturer after.
Really? Assignment sample.
Yeah, it's different from the assignment brief.
Okay, so see, I've shared something. Let's see if this is what you're talking about. I've shared something. 1.2. Can you see this? This one.
Yes, I
Um,
can see your screen.
okay, so let me see this one. Because the sample, unless I'm not getting, because normally after lectures we go back to discuss the details of the assignment you have to submit, and then we do a proper assignment discussion when you have finished the course for all the course until we end. But the sample is what I need to find out. You can also send a message on the group so my office admin can pick that up. Assignment sample.
Yeah, assignment samples, like assignment examples provided by ATHE.
Oh, okay. I might need to find out for a particular lecture. You mean?
No, for the whole as
Okay,
for the whole module,
for
for
the
the
whole
whole
module,
yes, for the whole unit.
for the whole unit.
Yeah.
Okay, just bear. Some
Then
sample.
I have another question.
Okay, go out the question.
Are there any opportunities for internship programs?
You mean in the UK?
Yes, please.
Yes, there are. If you talk to, yes, there are. So what are your plans?
Yes,
What are your plans, Vanessa?
I would love to go to come over to the UK.
Yeah, you can. In fact, some of the courses you are doing, you can
Yes,
even decide to come here and come and do some courses. Okay.
yes.
Yes, you can. Yes, you can decide to some register and decide to come and do some of the courses. You can come and do English programs. You can even the health and social care you are doing. Some of it you can decide to come and do it. So yes, there are. I would communicate to my back office and ask them to contact you so they can explain more about it. Okay,
Okay, please, I'll be waiting.
no problem. But let me look at your situation. So first of all, you answered this question. So you see, so if you look at task 2, what we just it says they should assess responsibilities for management and identify the priorities which are clearly specified in a chosen area. Okay, so let's go down and see various tasks and then how deep should. So let's see this. This machine. This is something. Hmm. So learning outcome 3. So assessment discussions, assessment template. See if this can help. Not it. That's not it. That's message radiation. That's message radiation. Okay, so I'm sure this might be what you're talking about. Let me see if I can share with you. Share. Let's look at the screen. Is it this one?
I have this one.
Or you have this one already?
Yeah, this is the assignment brief.
Yes, that's assignment brief.
Yeah, the assignment sample is literally an
Hold on. Let me
example.
call my office just for a minute. Hold
Okay, no problem.
on. Assignment sample, right?
Yes, assignment sample provided by ATHE.
It is. Mama, quick one. And Vanessa is asking that normally there used to be what we call assignment sample from ATHE that they give to some lecturers to give to them. Do you have anything for this lecture? Assignment sample from ATHE.
Suppose just to make them aware that how assignments are done and everything. So as a learner, she has already done a lot of sessions with us. She must have an idea that how the assignment should be done, right? So in that case, they have to prepare it on its own according to the assignment briefs which we provide. There is nothing else which we can do in that case.
Yeah, I've given
You need
him.
to give them
We have
diplomatic answer.
we have done the assignment discussions and everything, but you were saying that there's another thing called assignment sample, and I don't know what that
No.
is.
We don't always provide. That's not a standardized process which we do. That is something which a learner has to do on their own. We don't provide for each and every single unit.
Okay, thank you so much. I'll let him. Thank you.
Okay then.
Vanessa, you heard him when he was talking, right?
Yes.
Yeah. So if it's still of a concern, just send an email. Okay.
Okay.
Send an
I will.
email to the office generally, and then I'll also get back to you on the second one for
Okay,
the
please.
the what do you call it? The program
That
that you intend to. Okay. Yeah. So, okay. So we can explore different opportunities that we can put in place to on such exchange programs. Okay. But I think that even with this gives you a bit more understanding on the sample because it tells about LO1, LO2 and what you have to, I think it's here, you understand me. There must clear explanation and all that. So I think Aman's explanation was that it's normally for people who are quite new, but somebody like you have done a lot of lectures. They don't give samples, not every time, you understand me. That's what he was saying. Okay. Vanessa, can you hear me?
yes, I can hear you. I beg your
Aha.
pardon.
Yeah, I'm saying that the office was saying that it's not every time, and normally for people who are quite new, but not for people like you who have done a lot of lectures. You understand me?
Okay.
That's what he's saying. But if it's still a concern, I think send an email to the admin or whatever, and then they'll pick that up. Okay.
Okay, I will.
Okay. But the other one, I'll get back to you. Okay.
Okay, thank you.
Okay. So our next lecture is what? Is it a week from now?
Yes.
Okay. That's fine. Take care of yourself, Vanessa.
Okay. Thank
All
you.
right. Take care. Bye-bye. I'll share the information, the YouTube, everything on the link on the group. Okay.
Okay, please.
Okay. Thank you. Bye.